Hi, everyone. Good afternoon, and thanks for joining today's webinar on the end of the continuous enrollment requirements. My name is Lynette Rhodes, and I am the Executive Director for the Medical Assistance Plans Division with the Department of Community Health. And I am excited to announce that I am co-presenting today with Melody Debussy, who is the Deputy Commissioner with the Office of Family Independence with the Department of Human Services. Before we proceed with today's presentation, there are a few housekeeping items that I would like to mention before we get started. The first is just a reminder that today's presentation is being recorded and will be available on the GAMIS website after the presentation for your viewing. We will provide a link to the representatives with the Georgia Hospital Association to the recording, and that link will be shared with each of you. And the second item is just to inform you that a Q&A box has been provided for your convenience. We ask that you post your questions in the Q&A box. After today's presentation, a representative from Gainwell Technologies will review those questions, and Melody and I will do our best to try to provide responses to those. In the event that we run out of time and are not able to get all of the questions answered during the session, we will post the responses to those questions on the GAMIS website. If we have additional time today, we will open the floor for questions directly from the participants. So again, thank you for joining. We appreciate your attendance today. We'll kick off with talking about enrollment trends and sharing with you what's happened since the start of the public health emergency. As many of you recall, the public health emergency began in March of 2020. And since that time, we have maintained enrollment for all Medicaid and Peach Care for Kids members with certain exceptions. So for example, if a member moved out of state, they were disenrolled. If a member requested to voluntarily be terminated from the program, they were disenrolled. Or of course, if an individual was deceased. Aside of those limited circumstances, we have maintained enrollment for all Medicaid and CHIP members since March of 2020. So here we just give you a demonstration of how enrollment has increased. So in March of 2020, we were at 2.1 million members. As of February the 28th of this year, we're now at 2.7 million members. So enrollment has increased significantly over the past 3 years during the PHE. This gives you a further breakout of where these members are receiving services and which service delivery system they're enrolled with. So if you look on the first row, fee-for-service, those are our traditional Medicaid members. The enrollment numbers there represent 623,000 individuals. So the fee-for-service population consists of our aged, blind, and disabled population. So these are going to be our disabled individuals who may be disabled due to a SSA determination, our individuals who are in nursing home facilities, persons who are on our waiver programs. So as you all are aware, we have a number of 1915C home and community-based waivers that allow members to receive services in the community setting and also in their homes. And then we do have some children who have severe medical needs. They are fragile individuals. They are also included in our fee-for-service program, and a very small, tiny subset of pregnant women. If you look at the second row, there we've presented to you the numbers of members that are enrolled in our managed care entities. And in Georgia today, we have 3 managed care entities. The first is AmeriGroup, the second is CareSource, and the third is Peach State Health Plan. So this gives you our total enrollment again of 2.7 million members. So why are we having this session today, and why do we feel that this was important for the Georgia Hospital Association? We feel that it's important because it's definitely going to have some impact on your hospitals in a number of ways. So we'll talk more in the presentation about the requirement to verify eligibility for these members. We want to make sure that you are aware that we're going to start redeterminations in April of this year and what that impact will be to our members. And also just to talk overall some upcoming changes related to the public health emergency. So I'll start with the first bullet here, and this is to inform you that although we have maintained members on the rolls since March of 2020, the continuous enrollment requirements have now ended. So effective April 1st, we are now completing redeterminations for all of the members that have been enrolled since March of 2020. This will be a process that will take approximately 14 months to complete. So over the next 12 months, we will initiate the renewals and redeterminations for all members. And in the final remaining 2 months or 60 days, we will complete all of those renewals that are still outstanding at that time. It is important to note and understand that not everyone will go through this process at the same time. Each member has been assigned a specific month in which their redetermination or renewal will take place. And so if you hear me use the words renewal or redetermination, just note that we're using those interchangeably for purposes of today's presentation. We are going to implement certain processes and procedures to try to streamline this process. And one of those is going to be the alignment with SNAP and TANF. So as many of you are aware, quite a few of our Medicaid and CHIP members also receive benefits through the SNAP program and also through the TANF program. So to the extent possible, we are trying to align the Medicaid and CHIP renewals and redeterminations with the renewal dates for the SNAP and TANF programs. And Melody, if there's anything you want to add here, please feel free to jump in. Slide represents the timeline. I know it's not very easy to read, but it just gives you an example of when the redeterminations will begin. And so if you look here, we're starting now in the month of April. And from April through May of 2024 is our time frame for completing all of the renewals and redeterminations. Per CMS guidelines and requirements, we are mandated to have this process completed within the next 14 months. So we've worked very closely with the Department of Human Services and the Division of Family and Children Services to outline this process, implement system changes, develop policy, and take all of the necessary steps in order to ensure that this takes place. For those of you who may not be aware, we have delegated the eligibility, duties, and responsibilities to our sister agency, the Department of Human Services. So the activities that are associated with the redeterminations and renewals, all of those processes will take place within the gateway system that is administered by our sister agency, DHS. So we have worked very closely with them to align and make sure that everyone is on the same page in terms of all of our processes and next steps. We are taking what we consider to be a state-based approach. And through that approach, we are conducting renewals on an individual basis. So that means we will look at each member. We are attempting to align dates where there are multiple members in the same household. So if you have a family and they have different dates, to the extent possible, we have tried to align all of those dates so that we're looking at all of the members in that household at the same time. We have worked to try to organize them in logical groupings based upon staffing and worker roles. So for example, our aged, blind, and disabled members have been grouped to the extent possible. Same thing with Peach Care for Kids, Planning for Healthy Babies, our Katie Beckett members, and those under the Family Medicaid category of eligibility. And the other thing we would like to mention here is a reminder that pregnant women who are in the postpartum stage will remain on so that they can receive the full 12 months of postpartum services. All right, so let's talk about the renewal process and the ways in which a member can complete the renewal process. So as a reminder and as a starting point, renewals begin in the month of May. So we'll start sending out notices this month to members. They will receive by mail and email or email, depending upon, assuring that we have the correct contact information. But they will receive a renewal letter that will instruct them on the steps they need to take to complete the renewal process. So a member can renew online by logging into the gateway system, or they can call the 1-800 number that's listed here on the screen, and they will be connected with a representative and customer service agent with DFACS. They can go in person. The member can actually present at a local DFACS office to get assistance with completing the renewal process. And we have posted here the website where our members can identify and locate the locations and the office hours. And finally, a member can request a pre-populated paper form, again, by calling in or emailing a request to the website listed here, paper renewal forms at dhs.georgia.gov. Or, of course, they can go to a local DFACS office and make the request there. So there are a number of ways in which a member can complete the renewal process. In terms of the timeline, want to spend a little time here so that you all are aware of how things are going to be progressing over the next few months. The first written notices will be sent out to members on or about April the 15th. And these first notices will be issued to individuals who have renewal dates in the month of May. So you will find that, and we'll talk about this throughout the presentation, our general policy is to start sending out notices to members 45 days in advance of the end of their enrollment period. Again, we send the notices out 45 days in advance of the end of their coverage period. So for persons whose coverage is scheduled to end at the end of May, those notices will go out April 15th to all of those members. The earliest termination date for a member is going to be in June. So if you remember the timeline, April is when the notices go out to members. So no terminations are occurring in the month of April. That's the first notice, the first opportunity that we will have to send notices to members. In May is when members can respond. They can actually start responding in April upon receipt of the notice, but May offers some additional time for members to respond and provide any type of information that we've requested. May is also an opportunity for them to go online, complete the process, or they can call in or go to a defects office. So again, just want to emphasize here that in the month of April is when notices will go out, no terminations. The month of May is when the renewal process should be completed for that member. And for those individuals who are deemed ineligible, no longer eligible for Medicaid or CHIP, or for those individuals who do not respond, the earliest termination date for those members will be the end of May or the start of June, rather. For those individuals who do not respond and do not provide the requested information by the end of May, the good news is that they will have a period of 90 days thereafter in which to submit any requested information. So there is still an opportunity for persons who don't respond to submit the information within 90 days after the termination date, and then those individuals will be reinstated. Of course, we don't want to encourage that. We do want members to respond prior to the end of their renewal date so that there is no gap in coverage and that those members will be renewed for another year. But the realities are that some individuals are not going to meet the deadline. And so this is just an opportunity for them to be able to submit any additional information. I also wanted to just remind everyone here that if an individual is deemed ineligible and they disagree with that determination, that member does have the right to submit an appeal. And all of the appeals are heard before an administrative law judge at the Office of State Administrative Hearings. So that is a right that belongs to any member who is deemed ineligible or who receives what we call an adverse action determination. If an individual appeals that determination or that denial, their benefits will continue until the appeal is resolved. And that's resolved by the Office of State Administrative Hearings. And we also wanted to note here that terminated individuals are referred to the marketplace to perhaps take advantage of other coverage opportunities. I have here for you an example of a timeline for a renewal in May. And this same process will occur throughout the 12 to 14 month period. And so Melody, if you're able to jump in here, because I know you have this down.
Yeah, no problem. Yep. So we're going to trigger notices. They'll start going out. If members have given us their email, that's the fastest way for them to get their notice. We'll only email folks who we have provided their email as their communication preference in the Georgia Gateway system. Some folks have email and mail, and so we'll trigger those notices for May on April 15th. If we don't hear from customers, we're going to do a few things. So we both are working on a text message strategy, which we can also partner with any interested hospitals that want to also perhaps have some contact with information for our state covered partner toolkit, as well as provide a second renewal notice that will also go back again to their communication preference, either the email and mail or mail if that's what they've selected, if we don't get any information on their renewal forms. Finally, too, if we have a verification checklist that's generated, so if there's additional items needed, if we need to request additional, let's say, pay stubs or birth certificates, any of those types of information that the staff may need to process for determining eligibility, those will also be generated for requests to be sent to members. And so we try to tell our customers that they can't be too early when they get these notices and requests for information. They kind of can be too late to have, we'll say, smooth, continuous coverage during their renewal kind of period if their case is closed for non-response. And so we want to make sure that all of that doesn't happen. You can see that the notice of decision will be sent for closure, and that will happen the last day of the month of which the renewal date is month is up. So we'll send those notices for failure to provide that verification checklist or even just complete a renewal form. That notice will be generated and we'll review a decision. And so it will tell a member, this is the reason that your coverage was terminated, or this is the reason your case was closed. As Lynette said earlier, the reconsideration period is available to members whose case is closed for kind of non-response, as well as an ability to go back and continue to provide additional information on the verification checklist. If the original scans, let's say, sometimes we get pictures of, let's say, wage documents that are illegible to caseworkers. And so, we'll request additional information to try to make sure that we can view those documents that are submitted through our gateway system.
Perfect. Thank you for that, Melody. And so this timeline is representative of the process that will take place for the next 12 months. So it literally is the exact same process. And so I'm going to go back to slide 10 just to make sure that everyone is clear on what we're saying here. So this is for someone who has a renewal or redetermination in May. It's the same timeline if their renewal is in June or July or August or September or any month thereafter for the next 12 to 14 months. The only thing that will change is that instead of, for example, here where it says April 15th, if the person has a renewal date in June, the notice will go out on May the 15th. So that's the only difference here. And then if they don't respond, we'll send the second notice on or about June 12th. So it's the same process each month for the next 12 to 14 months. And again, that's because each member is assigned a renewal date in a specific month. So I did want to shift and talk about the Pathways 1115 demonstration waiver. So I'm not sure to what extent many of you have heard about this waiver, but Georgia did receive approval from CMS to implement what we're calling the Pathways to Coverage demonstration waiver. And this waiver will provide Medicaid coverage to individuals who otherwise would not qualify for Medicaid, who are aged between 19 to 64, whose income is up to 100% of FPL. They must meet the qualifying activities and they have to opt in. So the qualifying activities consist of, for example, work requirements, or attendance at an institution of higher education and learning, on-the-job training, participation with vocational rehab. So there are certain types of qualifying activities that the individuals must meet in order to qualify for the Pathways waiver. And so the reason why this is important is because it actually does intersect with the end of the continuous enrollment requirements. So we are currently targeting a proposed go-live date of July 1st of 2023. Again, July 1st. So literally just in a couple of months. And so as we're going through the redetermination process that Melody just described, we are looking to see if there are individuals who could potentially qualify for the pathways waiver. So as an example, it may be a member who is now age 19, who has aged out of Peach Care for Kids, because there is a cutoff for Peach Care for Kids. And so once you're age 19, you're no longer eligible for Peach Care for Kids. And so what we're doing is we're looking to see, okay, well, does this individual meet any of these requirements? Number one, they do fall within the requirements, the age requirements, right? Because the person is 19. Do they have an income up to 100% FPL? And is the individual meeting any of the qualifying activities? And so that is the process that we've taken to try to identify individuals who we feel could potentially be terminated from the Medicaid program. But to prevent that from occurring, we're looking to see if there is an opportunity for them to opt into the pathways waiver. If so, what we're proposing at this point is to delay the redetermination dates for those individuals to allow the waiver to go live. And then we will notify those individuals of this opportunity, and they will be able to opt in should they choose to do so. So this is just an approach that we've taken to hopefully ensure continued coverage for those individuals who otherwise would not qualify but meet the requirements of the pathways demonstration waiver. I did want to just mention to this group that we've received a number of approved waivers from CMS. I won't read each of these to you, but these are things and waivers that benefit us through this process. The first bullet here just tells you that we have additional time to resolve administrative appeals. And so these are, again, for those individuals who may disagree with a denial or termination notice. This gives the Office of State Administrative Hearings additional time to complete the appeals, because we know that there is going to be increased volume over the next 12 to 14 months. The second bullet allows us to utilize contact information and addresses and emails from our managed care plans. The third bullet allows us again to align with the SNAP program, as we've discussed. On this slide, same thing for that first bullet. It allows us to align with the TANF program. And this next bullet here allows us to assume that there have been no changes in resources verified through the asset verification system if we don't receive any information back. We are also allowed to accept updated address information from the U.S. Postal Service or the National Change of Address database. And we can also complete ex parte renewals when no income data is returned. So these are just, again, a number of waivers and flexibilities that help to streamline this redetermination process. So these are favorable to both the Medicaid and CHIP members and to the departments, again, just to help streamline and simplify the process. We are working closely with DFACS on a number of administrative processes. Melody, do you want to kind of talk about, the staffing and the statewide renewal team and the, yep.
Yeah, so a couple of things that we've been doing to gear up for a while. So we started an aggressive push to hire and add folks to our team, and also to support a statewide renewal team that would have the staff sufficient numbers to process renewals independent of county of origin. And so we've been trying to build that team aggressively starting from last fall. And we actually had additional folks join that team even on Monday. So we have new hires kind of continuously being trained and joining the team. So renewals are going to be routed generally through the statewide renewal team with some kind of minor exceptions. We're also conducting lots of interviews, and so happy to have you guys also amplify our job postings as we continue to hire and train folks in advance. Obviously, we're gearing up for the start of redeterminations that kicked off April 1st, but you guys just heard it's going to be a full year process. And so we're going to be continually looking to increase staffing on our team throughout the period and honestly for the long term as well. A couple other things, I'll talk about the kiosks in public libraries. So we also have started a partnership and are putting Gateway specific. That's the eligibility system of which members can complete their renewals for all of our programs, but especially Medicaid and CHIP in public libraries. So we have 200 terminals, we'll call them, that are kicking off into libraries with the first 14 going out in the next few weeks. Our goal is to cover all 411 library locations and bookmobiles to give members additional opportunities outside of DFAC's hour locations for nights and weekend access and public libraries to be able to access the internet and complete their renewals. The online renewal process is the easiest way because it prompts members for the information that we need to corroborate or verify outside of the full renewal forms, which can ultimately is dozens and dozens of pages. So it helps folks to hone in on what exactly information we need to process their redetermination. And Lynette, I'll let you talk about OSA.
Yeah. So again, just a reminder, if anyone receives a denial or termination notice, they can appeal to the Office of State Administrative Hearings and have their case heard before an administrative law judge. So we've implemented some automation to help to transfer the appeals over to OSA so that they can receive those timely and make sure that they can get those calendared and have all of the data that they need. So this is, again, is just a process that we've implemented to streamline and to help move things along so that there are no delays on our end and we're able to help the member. All right, I want to talk a little bit about some provider considerations and things that GHA should definitely be honing in on and preparing for. So as we begin the redetermination process, our goal is to ensure that there are no erroneous terminations or denials. That is our number one priority and goal. And by doing so, that will ensure that, the most members can remain enrolled and that there will be no gaps in service. However, the reality is that we do know there are going to be some individuals who no longer qualify for Medicaid or Peach Care for Kids for various reasons. Number one, the example I just gave could be someone who has aged out of Peach Care for Kids. And so while we've maintained them on the rolls since March of 2020, now that we are completing the redetermination process, that individual would no longer be eligible for Medicaid. We hope that they would qualify for pathways, but if not, they would be referred to the marketplace. There are individuals also whose income has increased significantly over the past 3 years. And so those individuals may no longer be eligible for Medicaid as well. So again, we do know that there will be terminations. Well, why is that important for GHA? What that means is you all will have to verify eligibility on each date of service. I know that over the past 3 years, some providers have, kind of taken a more relaxed approach and attitude because they knew that the members were continuously enrolled and that we were not disenrolling any members. But at this point in time, now that we have begun the redetermination process, it is critical that you all verify eligibility on each date of service. For the second bullet here, even if you have received prior approval to render services to a member, you have to verify eligibility on the date of service. Please remember that receipt of prior approval does not guarantee payment. And so it's critical that you verify that eligibility. And then finally, if that member is not eligible on the date of service, then that provider will not receive reimbursement. So again, that verification piece is critical. Just as a reminder, how do you verify eligibility? There are a few ways. You can call in to the provider contact center on the GAMIS site. You can log in to the GAMIS site and verify eligibility at the mmis.georgia.gov website, or you can verify it through your clearinghouse. So those are three opportunities that are available to verify eligibility. In terms of a communication plan, this is also another critical part of this unwinding plan. And so I am excited to announce that the Department of Human Services has entered into a contract with a PR firm, Jackson Spalding. And so we're trying our best to go really big on the communications plan. So we have already established a website called staycovered.georgia.gov that's listed here for you. And if you log on to that website or you click the link, there's a toolkit there. There are videos that have run publicly in the media space. There are FAQs, frequently asked questions for members. There are instructions for members on how to log into the gateway system. So there's a host of information there. DHS also has a Medicaid unwinding page that has a lot of information about this redetermination process. So I wanted to be sure to share this with you. We are also participating in a pilot with CMS where we have what we're calling a local connector. And so we have an individual who lives here in the state of Georgia, Ms. Simmons, who is actually out beating the pavement every day, going to various community-based organizations and provider offices and to pharmacies. She's leaving flyers, she's giving handouts, she's sharing information and answering questions about the end of the continuous enrollment requirements. She's also circulating information to a number of local organizations like food banks, churches, other types of the Department of Education, for example. So she's trying to go to as many places as she can to inform individuals about what's happening starting this month. We are also posting a number of banner messages, and we're presenting out information on unwinding at all of our board meetings and community meetings or committee meetings. And of course, just like we're doing today, we're collaborating with the various provider and member associations and our advocacy organizations. Our CMOs are also going to help us a good bit with our efforts, as they will be doing direct outreach to each of our members to remind them of when their redetermination dates are coming up. They'll be distributing FAQs to members as well. And we are also, I will mention, in the process of developing a provider frequently asked question document that we will be posting very soon. So here's just a picture of the staycovered.georgia.gov website. Again, these are just some of the frequently asked questions that you will see when you log on. And so how can the Georgia Hospital Association help? And we do need your help. We are requesting that you notify your Medicaid and Peach Care for Kids patients, as well as the members of the association, that redeterminations began on April the 1st. And in terms of, how this can be done, text messaging, phone calls, emails, when patients present at your hospital facilities at the time of check-in, saying to them, hey, I know that you're a Medicaid member or a Peach Care for Kids member. Have you participated in your redetermination process? If not, please keep a lookout for the notice. Please check your emails. Please check with your care management organization, or please call the Gateway system. So, we need your help in terms of spreading the word. Again, reminding the members to update their contact information in the Gateway system. That is critical because we have to be able to reach the members. And then, to the extent possible, assisting with the redetermination process. I do want to talk a little bit about the public health emergency because that is also soon to come to an end. So the public health emergency will end on May the 11th. And you may be wondering or saying to yourself, well, isn't that what we've been talking about? So there is a distinction. The 2023 Consolidated Appropriations Act decoupled or separated the end of the continuous enrollment requirements from the public health emergency. So prior to the enactment of the Consolidated Appropriations Act of 2023, the two were linked together. And so our previous communications were, at the end of the PHE, we will begin the redetermination process. At the end of the PHE, we will do A, B, or C. Well, now they have been separated. So again, we have already moved forward with ending the continuous enrollment requirements. And on May the 11th, the waivers and flexibilities in place that related to the public health emergency will also end. And so we're reviewing now to determine which of those flexibilities will remain in place and which of those will automatically end. So we will keep you all posted as it relates to those particular waivers and flexibilities. But here are some that relate directly to providers. Provider revalidation is one. So for providers who have not completed their revalidation, that process will resume on May the 11th. And all individual practitioners and facilities are required to revalidate. So this applies not only to physicians, it applies to hospitals, the facility itself. So you guys will be required to complete the revalidation. Site visits will be resuming. All prior authorization requirements will resume. So as you all are aware, the CMOs, the care management organizations, relaxed a lot of the prior auth requirements. And so those will resume on May the 11th. Application fees will be reinstated for providers who are applying to become enrolled providers. Our PASSAR assessments will resume, and the provisions related to services in alternative settings will end. That last bullet is also a very important one, and it ties to, for example, if you all will remember, I think at the Georgia World Congress Center, we had set up a site there, and a number of the hospitals had pods set up outside of their hospital facilities or were operating in these alternative settings. And so that ends on May the 11th. So just wanted to make mention of that to this group. As it relates to members, some of the things that we're looking at are the waiver of the premium payments for CHIP members. So we suspended those during the public health emergency, and now we're discussing and reviewing whether or not those will be reinstated. Co-payments. So members have not been required to pay co-payments since the start of the PHE. And again, that's another flexibility that we're reviewing. So there were quite a few of those provisions that we're looking at. I think telehealth is another really big item that we've gotten a lot of questions about. I can tell you that it is our intent to keep in place the majority of all of the telehealth provisions that were put in place. So as you all are aware, we expanded telehealth provisions significantly during the PHE, and the response has been overwhelmingly positive, which is great. And so we've heard providers loud and clear, and so we're going to keep those things in place moving forward with a few tweaks. So just wanted you all to be aware of that, but we'll share all of that information with you in some upcoming banner messages and postings. So I am now going to open up the floor for Q&A. I do know one of our Gainwell representatives has been monitoring the Q&A box. So I'm going to turn it over to you all now to walk us through any questions that we've received.
Okay, good afternoon, everyone. We have a question from Julie Phillips, and she wants to know if they do not meet the deadline, but they meet the requirements in the 90-day grace period, will the coverage go back retroactively?
Yeah, Melody, do you want to take that one?
Yeah, sure. So if a member comes after their case is closed for non-response or non-return of their verification checklist information items, then when they ask to kind of complete that, the case worker will try to pick that case back up. And when we run eligibility, if they're eligible, it will move them to the month of their renewal. So yes, it doesn't necessarily, I think all of those things have to line up, right? So for that to work, right, where they have to submit information that then when we check eligibility, they are eligible in the time frame to get that done. But we always encourage members that have case closures due to non-response to go ahead, and their first item after the case closure is to, yes, continue to try to resubmit those items, even if they're not timely, so we can run eligibility and continue their coverage for when their renewal month was up.
Okay, thank you for that answer, Melody. And we have another question from Donna Hatcher. Her question is, will the redetermination date be shown on the eligibility verification on GAMIS and the CMO websites?
So that information does not GAMIS at this time, not for providers. The CMOs have this information. We do share that with them. That is something, Donna, that we can take back to the team to look at closer to see if that is a systems change that we can put in place. But excellent question. Excellent question.
Yeah, I would say from the member side, any members that you come into contact with, if they log into Gateway after April 17th, they would be able to see their eligibility, period of eligibility month due for review after the notices are triggered. So folks that log in that week of April 17th will be able to see what months they're up.
Good afternoon, everyone. We have another question from Joe Cabison. Can any further detail be provided to the monthly rollout plan, example within the blind, disabled, PCK, or KB groupings? And he wanted to know, is that month's rollout plan by a last name alpha split or some other identifier?
Yeah, so good question. So our general eligibility leveling looks at both workloads that would be achievable to be processed by our staff. So nearly all categories of assistance are going to have some membership that is up for renewal starting in June. In May, we're starting with our ABD population predominantly. And so I would say we're trying to align them mostly with SNAP and TANF cases. So it's possible if members are also on other benefits, if they have a SNAP case, for example, we tried to align cases for families. So although we do eligibility at an individual level, we also tried to say if we're talking to a family about their SNAP case and we gather all of the information at that time, that would be necessary to complete their Medicaid renewal, that occurs for that family assistance unit, we call it. We also attempted to align, as Lynette said, across families. So so that a family wouldn't have to go through eligibility multiple times as much as possible. And then we also tried to ensure that we had our teams able to work all of those cases. So all of our teams on the ABD side are segmented to try to deal with the level of care expectations around that categories of assistance, as well as our family Medicaid staff as well. So based off of our roles, we had level set across alignment of benefits and across family units.
Okay, so we have another question in the QA chat from Brent Hip. He wants to know, will providers be provided with a report of their Medicaid patients to include their redetermination dates?
I'm sorry, Chassie, I couldn't hear you.
Oh, I'm sorry. Can you hear me?
Yes, if you could
Yes.
repeat the question.
Yes. Okay, so the question is stating, will providers be provided with a report of their Medicaid patients to include their redetermination dates?
So we've not talked about that yet, but again, another excellent question. So that is something that we can take back to the team to see if that would be possible, or at least at a minimum, the ability of a provider to log in and see, I guess, their panel of patients from that angle. So I'll take that back. Again, an excellent question.
Okay, and we have another question from Lauren Cozart. If a member is inpatient during the re-enrollment period and their eligibility ends due to no response within the 45 days, will the full inpatient stay be covered?
So we are discussing that internally now. We are developing and outlining some scenarios, such as that one, and we're going to add that to our frequently asked questions for providers so that you guys are clear on how all of the rules will play out. But that's one of the scenarios that we're looking at. Is how is that going to happen? And that could very well happen. It happens. Well, it happened pre-COVID. Where we did have members who would lose eligibility in the midst of a hospital stay. And so we'll answer that question in the written FAQs.
Okay, we have another question from Kevin Jennings. Are you able to provide a percentage breakdown of how many members prefer their communication preference, email, telephone, etc.?
Melody, I don't know if you have that information.
Yep. So good question. So we did do a pretty two important things last fall at DHS. So one was standing up the Stay Covered campaign and George the Peach. So lots of provider toolkit options for you guys to partner as well. We also did a specific rollout of a one-time assistance benefit. And I can tell you that about 33% of our covered members now choose email as an option. Obviously, there's still an opportunity for all members to go in and update that and choose to have their communication preference set to email and mail or email exclusively. So as you guys serve customers as well, if you want to encourage them to ensure that their information is up to date when their renewal comes up, that would be also helpful for us in addition.
Okay, Lynette, I don't have any additional questions in the Q&A box.
Okay, we've got a few minutes left. Can we unmute the participants, or is there a way for folks to identify if they have any other questions that they want to ask? I think one question that I would like to ask the participants is, would you all be interested in having a follow-up webinar session, just like this one? And the reason why I'm offering that up is because you may think of other scenarios that we need to address, or other questions that we could talk about. We really, really want to have your partnership to help this to be successful. So let me know. You can put it in the Q&A box, or for Gainwell, I guess, if you can
Mhm.
unmute.
Yeah.
But we'd like to know if you all would be interested in a part two, so to speak.
Okay, Lynette, we definitely ask if you have some additional questions that you don't want to vocally ask, that you would like to ask vocally, please raise your hand and we will unmute your mic so that you can ask that question. There was one addition or two comments that were left in the Q&A box. One was, will we be sharing these slides? So
Yes.
the intent, yes, is to post it onto the Gamma site. So yes, we will be posting that later today. And a response to your question, Lynette, was yes, that would be a great idea for us to have some additional webinars as well.
Okay, got it. So we can work to schedule those with GHA in the excuse me. In the meantime, if you have any other questions or scenarios, particularly for Donna Hatcher, send those over to us, Donna, and we can flesh those out and have answers to present to the group at our follow-up session or our part two.
Hey, Lynette, this is Donna, and I want to thank you, first of all, for doing this afternoon. We really appreciate it. I do think a follow-up session would really be appreciated. Maybe after the FAQ comes out, we have a chance to look at that, and then after a little more of the process has taken place and we start to see the questions that come up, I think that would be very helpful.
Okay, absolutely. Thank you, Donna.
Lynette, I don't see any additional hands raised. I do have a couple of different comments that says yes, a follow-up would be very helpful.
Okay.
One more question. Looks like Thomas Lynch wanted to know, yes, we would like a follow-up. Also, if you could update us as to the numbers when people are coming off the Medicaid rolls.
Okay. We can do that. And there's a good bit of reporting that we have to do with CMS on this process. And so, and in addition to the reporting for CMS, we're going to be doing some real-time monitoring as well to monitor the number of individuals that are falling off at the end of each month. And so, yes, we plan to share that information and be very transparent so that folks are aware of what's happening.
And one last question, just to reiterate, there was a question again, will the session be recorded? So yes, the session was recorded. And will the webinar be available on the Gamma site? So we will be posting the presentation on the Gamma site with a link for the recording. It will be under the provider information subcategory provider notices where all of our normal training documents are. And we hope to have that posted sometime within the next 24 hours. And I do not show any additional questions or hands raised from anyone.
Okay, so, oh, Donna.
Oh, go ahead.
Yep.
Oh, I'm sorry. I forgot to lower my hand. I unmuted my mic and made my comment. Thank you.
Okay.
Although, wait, I did think of another question, actually.
Okay.
Will there be any indication on the online verification or on ID cards once the revalidation has taken place? In other words, when we see a patient, will we know when we need to keep encouraging them to go in and work on that, or will there be an indication that it's been done?
If you go into the Gamma site, you will know if a person is still eligible. And I'll double check, Donna, to see if it'll tell you the extension date. You know, like if there's an indicator that says this person's extended for another year, I'll check to verify that and we'll add that to the FAQs.
Thank you.
Yep.
We have a question from Eve Brown. Your mic is open, so you should be able to speak.
Yes, you said you were going to put the video out on the Gamma site. Are you also going to put the presentation?
Yes, we will load the presentation under provider information subcategory provider notices on the GAMAS portal. Yes.
Thank you.
You're welcome. I
Well,
don't
I
see
hope-
any additional hands raised. Go ahead.
Thank you, Sharana. So I hope that this was helpful. We will work with Donna Hatcher and her team to schedule a follow-up and a part 2. I want to thank my co-host, Melody Debussy. Thank you so much, Melody. Melody is actually on vacation this week, y'all, and still jumped on to join us. So thank you so much, Melody, for your dedication and commitment. I really do appreciate it. And so thanks, everyone. Have a wonderful afternoon. Have
Lynette,
a
I'm
happy.
sorry. There's
Yes.
one more question in the Q&A box. I do apologize. One more question.
Okay.
It states, will the letters for denial for over income list the details for denial such as FPL percentage?
Melody, it tells them that they're over income. I know we give them the reason why. Do we
Yep.
specifically? Yes.
Yeah, so we don't recalculate for denial notices. Our notices aren't dynamic that way, but they will tell the reason that the denial occurred. So we'll indicate which ineligibility kind of component, if you will, or context for which a member is no longer eligible. And that would be direct them to any type of information to submit as, in an appeal situation.
Okay.
one
Sharana,
other-
any other? Oh, go ahead, Melody.
I'll note
sorry.
one other thing. So we also are going to kick off text messages to members that we are unable to find, that we receive return mail on, or we will also run a text message to members that are non-responsive within the 10-day window of their case closing. So if any of the providers decide to text their members, if you could just ping the department, that would be helpful. We get a lot of cases. I know some providers have been texting their members, directing them to our call center. Our customers a lot of times call their case managers to see if they're being scammed or if the text is related to their coverage being up, or lots of other questions. And so additional heads up so that we can help best serve customers as well is also appreciated. Lynette, and I can drop in the department email when you guys post this information to let us know, and we can help coordinate you guys. Our Stay Covered website, as Lynette mentioned, has lots of partner toolkits, everything from coloring sheets to lots of translations to our top 7 languages that we serve in at DHS to be able to help serve members as well. Thank you.
Thank you. Thanks, everyone. I agree. Again, thanks for your participation today. Have a wonderful weekend. And Donna Hatcher will follow up with you on next steps. Thanks, everybody. Good afternoon.
Thank you both. Bye.
Thank you. Bye-bye.
Thanks.
Bye.